Hi, good morning, Navi.
Hi, good morning. You're seeing the presentation? Great.
Yes, sir.
And the audio is good because it just started to rain here, so it's a little
Yeah,
loud
that was my challenge as well. Okay,
Oh.
so if we are ready to start, I will go ahead.
Yes, sure.
Hi, good morning, everyone. Thank you very much for joining us today for this virtual EAP session. I am Kavita Chankar, the Manager of Operations and Stakeholder Relations at the Trinidad and Tobago Coalition of Services Industries. We are very happy to have with us today Dr. Navi Muradali, CEO of Virtual Wellness, to take us through today's presentation and to answer any questions that you may have on virtual EAP, what it is, how it can benefit your company and your employees. So without further delay, I will hand over to Dr. Muradali. Thank you.
Okay, thank you very much, Kavita and the team from the TTCSI. Good morning to all the participants. Thank you for coming out on a rainy day. I'm in South Trinidad right now, and it's very rainy outside. But thank you very much for attending. So I'll just get into the presentation. Right, so basically, I'm the Managing Director, CEO of Virtual Wellness and Patient Connect. These are online platforms. They're digital health platforms in Trinidad and Tobago and the Caribbean. And Patient Connect is really designed to reduce the burden of disease and to boost wellness and savings in Trinidad and Tobago. So, you know, let's try to address the problem, and then we will discuss some of the solutions that Patient Connect provides. So what's the problem we're really trying to solve? For those of you who are HR persons, you are very familiar with the employee assistance programs, and you would have your own experience over the years using these EAPs. Many people use the EAPs for counseling, psychological assistance, and so forth. But we will discuss some of the problems that we currently face. Then we will, as I said, discuss the solutions, and I will certainly take any questions that you have later on. So at this point in time, in my experience, working directly with EAPs over the many years in various companies I worked for, Atlantic LNG, companies in the estate, and even in private practice, we find that, you know, the employee assistance programs, while they have served a great purpose in the past, they usually come with some limitations. And those limitations is that, you know, it may just be for counseling. If you needed a EAP, let's say, to provide more services, you would have to go outside of the current provider. For example, if you wanted a medical specialist or you know, a dietitian or so, you would really have to go outside of the provider, because no one company would provide all of these services. The challenge also is that, you know, many providers would offer retainer fees to the company. So for example, you know, you have to pay every month something towards the service. Also, you know, you have a lot of these difficult contracts, and it's difficult to find a multidisciplinary provider. So as I said, you know, to provide maybe doctors, to provide specialists, to provide dietitians, psychologists, you know, whatever the requirement was, you would really have to have multiple companies or multiple providers for these services. The other issue that we have, and this falls directly into the work that I do as a medical doctor, is that we have to really deal with this burden of disease. Just today I was reading the Chamber it's a very good article. I'm not too sure if it's today's newspaper, but the Trinidad and Tobago Chamber of Commerce, Ms. Rima Mohammed, and they put together a nice article today on the effects and the costs of non-communicable diseases in Trinidad and Tobago. I think everybody should read that article. And it really falls in line with what we have been advocating in Patient Connect and virtual wellness, where we really need to provide greater access to employees of companies when it comes to dealing with these lifestyle diseases. It's not just good enough to say, these persons could go and access, public care and get a checkup every 3 or 6 months for their diabetes or lifestyle problems. What about getting access every day to a portal where you can upload your results and all of these things? So the burden of disease really has to do with access. Can people access healthcare in real time? And can it be cost effective? That's the question. Can it be very easy to use and cost effective? And the answer is yes. Both of those are available in Trinidad and Tobago right now. So we know that with the burden of disease, your employees, they take a lot of time off because, of the diabetes, the high blood pressure, the heart disease, and therefore that comes at a cost to the companies, and of course, downtime, lower productivity. And then, of course, if there's an unacceptable outcome, such as, you have a heart attack or they end up getting an amputation, that's another burden to the healthcare system. And it's also a burden to insurance because, you have an increased claims ratio and all of these things. The other issue that we have is that, well, there's no virtual healthcare prior to Patient Connect that would address the concerns of companies and the employees. As I mentioned before, there's no all-in-one provider. The other issue is that we all want to subscribe to the circular economy. We want to see that we cut down on the carbon footprint. And therefore, healthcare is a very good place to start, because what if we could have a healthcare service that is paperless, that we can reduce the cost of driving to the health providers? So savings in terms of gas, savings in terms of paper. And many times, when you think that you have, let's say you go to a doctor's visit, you really don't factor in the other costs. And the other inconveniences that you may face, the traffic, the waiting time, as I said, the gas, all of these things. So healthcare does have a 4.4% contribution to the global carbon footprint, and this can be significantly reduced when you offer virtual solutions. So we discussed some of the challenges of the healthcare system, and in particular, what employees and employers have to face. So what are some of the solutions that we can provide? So right off the bat, how about the employer, or rather the employee, connecting directly with any of the health providers that they choose? For example, a doctor, a medical specialist, a dietitian, a psychologist, even if they need legal advice. What if they want to find out more about insurance and insurance products, physiotherapy, for example, other alternative modalities like Reiki, yoga? What if they want to access all of these services in one platform from their smartphone? So that is available using Patient Connect, and there's no app to download. There's no particular operating system or web browser. It's easily accessible via a link. And I think we all know how to use a link. You use links on WhatsApp. You can use your link from your emails. You can share a link any way nowadays. The other solution that Patient Connect provides is the access. So we spoke about access earlier. Access is very important. The greater the access, the greater the patient engagement or the employee engagement with a provider. It means that, you know, there is greater compliance. When there's greater compliance, it means that the outcome is going to be better. So case in point, there's a death with a relative of an employee, and they require, you know, they want to speak to, because of their grief, they want to speak to a counselor. This can be done virtually. Can it be done virtually after hours? Yes. Can it be done on a weekend? Yes. Can it be done on a public holiday? Yes. So you remove the limitations of the past where you have to necessarily have a, you know, an appointment in a physical space where and it's restricted to certain times. That no longer exists. And the benefits you will see as we move along. The other solution is that because virtual services tend to be cheaper, there's a lower cost to these services. It's a general savings both for the individual, the company, and of course, if there's an insurance provider, it's a benefit to the health plans. So there isn't any burden on anyone. So I'm just giving you an example. If a doctor's visit, for example, in a clinic, physical clinic is say $300, on Patient Connect, almost all the providers charge, let's say, $200. So you can see that there's a savings there already, especially, you know, for routine visits. So we're not talking about something that you have to go and see a doctor physically for. We're talking about, let's say you're following up on your diabetes, or it's a minor complaint, a minor issue, you are at work, you need to access some care. That could be done at a more in a cost-effective way. Or it could even be done after hours, as mentioned. So there's no need to go to a brick and mortar clinic. Even though on Patient Connect, when you're booking, you can book both for a brick and mortar clinic, so a physical visit. You can book for a home visit, and you can also book for a telehealth visit or a video call. So those are the three ways that an employee can connect to a provider. The other savings, of course, and this is about the carbon footprint, is that the providers that use Patient Connect, they all are paperless, so they all keep their records in the electronic health records on the patient portal, and therefore, if the employee and the employer requires the medical reports, that can be sent electronically through the secured patient portal. So you don't have the issue of waiting for a physical report to come to you, and you have to have a courier, and you have to get, you know, all of these things. These things can be done at the end of the consultation. If you request the notes, that could be forwarded to HR department, for example. So, and this, of course, you know, is part of the whole thrust, as I spoke about, in terms of going paperless and reducing the carbon footprint. And you definitely, you're going to, if you do it virtually, you're going to be saving on gas, which is something that, you know, we all want to do these days. So the benefits, again, I mean, there are many, many benefits of using a virtual EAP, a virtual service. And in addition to, you know, you have a wide range of health providers, and they're not limited to just Trinidad and Tobago. They're also health providers that you can access out of the country. You can, you know, book with ease, as mentioned. You can book a clinic appointment or a video appointment. All this can be done either through the HR department, or the employee can do this directly. There are many health providers on Patient Connect: GPs, specialists, dietitians, nurses, therapists, physio, pharmacists, legal, insurance, as I mentioned, yoga, Reiki, all of these different modalities. And all of this could be done after hours and on weekends. The client will always have access to their client's notes or patient's notes. And one of the nice features I like about Patient Connect is that once someone becomes registered, they receive health and wellness information once a week to their emails. Sometimes they may get an SMS, and if they subscribe to the WhatsApp service, they also receive various links on their WhatsApp. So the important thing here is that it's not just getting a service when required, but you're always somehow have an engagement with the health and wellness information. So we may send out an article, as I said, once a week. This week might be some tips on diabetes. Next week might be some tips on weight management. The week after, maybe some tips on asthma. So there are so many different things that we send out that we are always trying to keep the engagement of the employees. The other feature of Patient Connect, which I think is very, very valuable for those companies where you may have diabetics, patients who suffer with high blood pressure, is that on a daily basis, they can use the Patient Connect service to enter their health numbers. And what are these health numbers? For example, a blood sugar or high blood pressure values. They can enter these values on a daily basis. And whoever their provider is, so once they have a provider on the service, that provider will also have access to the numbers. So this is now real-time engagement. So if you want your sugar levels to be monitored, you do it over a week, 2 weeks. And if your provider sees a certain trend, and maybe the sugar is increasing, something is happening, they can make an intervention at that point. You don't have to wait 3 months or 6 months or 1 year or what have you. This is in real time. So this is another key advantage of having a virtual service. Now, if there's a concern about privacy, security, and all of these things, Patient Connect is a signatory to the BAA, which is the Business Associate Agreement. And so therefore it is HIPAA compliant, which is a US-based legislation governing security over the web. So it's a signatory to that. And also GDPR, which is a UK European telehealth compliancy software. And we also host everything securely on Amazon Web Services. So it's always secured, encrypted, and there's no issue of security threats and so forth. So that's something that I wanted to mention there. So the services, I think I mentioned all of these already. The beauty again of a virtual EAP, that the company does not pay any retainer. There's no fee for the services. It's just what you use. So for example, if the employee today needs psychological counseling, maybe 2 sessions, 3 sessions, you just pay for those services. If they require to chat with a doctor online, you just pay for those services. If you want any consultation, if they want some dietary counseling, 2 sessions, 3 sessions, that's all they pay for. There isn't a subscription service or any sort of other fees other than those fees I mentioned to you. So on most of the fees, you'll find that the fees are very, very affordable, much less than if you have to physically go in. Most of our psychology fees or counseling fees are in the range between $250 to $300, which you will realize it's a lot of savings. And you can access these services anywhere, anytime. Once you have a smartphone or a laptop or a desktop with internet, you can access Patient Connect. There's nothing to download. Payment, many people like to find out, well, how do we pay for these services? Well, if the employee has a credit card, they can pay online. If they do not have access to a credit card, it's very easy. Wherever we pay or use or any bills are paid, they can make payments at those locations. So we have WePay use, and you can do online banking as well. So it's very easy in terms of the payments. How does it work? Very, very simple. So there are really two ways. Either the company would tell the employees, give them the link, let them individually sign up, or if the company wishes to onboard their employees, if the employer wishes to onboard the employees, they can do so. It's a very simple Excel spreadsheet. And then on our side, we onboard all of them so that they can start receiving their emails and all of these things. And if they require to use the service, then it's very simple. There's no signing up again. You just have to log in. So that's the easy way to describe it. It's just a link. Once they come onto the platform, you will see the various services, the various providers, you will see the various fees, and you will be able to book an appointment. It's a calendar, and you just decide, your date and the time. You click on it, you get a notification on your SMS, on your phone, and your email, so you know that the appointment has been booked. Once that is done, we have our virtual assistants. They're like our customer support. They will contact the employee and confirm the appointment. And if the employee has any concerns about payment or any other issues about using the service, the virtual assistants are well trained. They will discuss that with the employee. And then on the day of the appointment, the virtual assistant will also make a phone call to make sure that the employee is in a secure place, they have internet access, they remember the appointment, and then they log in and they have their consultation. So it's very, very simple. There's nothing complicated about it. We have had thousands of people use the service during the pandemic, and the more people become familiar with telehealth, they realize that there isn't anything about it that is so difficult. It's very, very simple. So we have partnered over the last few years with various organizations. We've done work with PAHO during the pandemic, also with the Trinidad and Tobago NCD Alliance, Diabetes Association, and many, many NGOs. And there are many NGOs who currently we work with who utilize the service. We have different types of services that we provide to the NGOs, and all of the NGOs that you see there currently utilize the service. Now, the advantage of using a virtual EAP, one of the key things is, well, it's all locally designed and managed. And that's a good thing because our articles tend to reflect what's happening locally. These are not articles we're going to pull from Google somewhere or some international medical site. Whatever is happening locally, that's what our health providers report on, and that's what the blogs are. And I can send you the link for some of the articles that we currently have, and you will see that it's very locally oriented. I did mention how easy it is for the payments. I also mentioned about the regulations that we use, which is HIPAA compliancy and GDPR, to ensure safety and security of the platform. And again, ease of use. Another advantage, using something virtual is that it's actually very good and very useful for your HR teams because everything is in one place, all the reports, all of the information. It's very, very easy to track what's happening with the employees. So from that standpoint, it's really, really it's going to save you a lot of time and effort in your HR departments when you can see the benefit of using a virtual EAP. The other things is because we utilize our IT services locally. We hire, the more we expand, we hire these virtual assistants and product specialists. We're really just increasing the local job market, which is good for everyone. So providing jobs is always a good thing. And as we expand into the Caribbean, it's a good good form of medical tourism. And we really try to attract more Caribbean specialists as well to be added to the platform so that your employees have a wide range. So if there's I'm just giving an example, but if one of the best cardiologists in Jamaica is on the platform, for example, they can have access to that person. Traditionally, it would be very difficult to get access to that provider, but now it's much easier using these telehealth services, and so it's not just limited to local professionals at this point in time. We will be expanding. Right, so we have some testimonials here. We've done work with Swim Call. We've done work with family planning and a lot of other organizations. So the key thing is that we have done this over since the start of the pandemic. We were putting together the platform, and now we have reached a point where we've decided we can certainly offer this service to the not only to corporate TNT, but to individuals. So today's presentation is really about more of the, targeting is more B2B, your companies, your HR departments, looking at the virtual EAP. But there's so many benefits that I'm sure, we didn't cover it here, but in our Q&A, we could discuss further about it. So, I think, that's where I would like to leave it here, but I would certainly like to now open up the floor to any questions that you may have.
Navi, I have a question for you with
Sure.
respect to the provision of updates, access to the blogs, etc. Is there a cost associated with that? And if so, is it a one-time cost or is it a recurrent expenditure?
The only expenditure is when an employee utilizes a health provider service. So when they book an appointment and they have the service, that's the only cost. The updates, the blogs, the emails, whatever is sent to SMS, that there's no cost associated with that. Neither is there a cost to become onboarded. There isn't a subscription fee, there isn't a sign-up fee to utilize the virtual EAP. You just pay for what the employee uses.
And is there a limit to the range of medical services provided? Like, are there specific specialties, or is it all fields that you can access?
So yeah, but very good question. So we have product specialists, and they are responsible for trying to onboard health providers, including specialists. And we currently have orthopedic surgeons, we have obstetrics and gynecology, pediatrics, and we keep adding specialties. So even if you can't see how any of these specialties, because most people believe that they have, yes, you may have to physically go in for your first checkup for if it's something, where you require the doctor to maybe put a stethoscope, or obviously if it's an emergency, you have to go in physically. But the virtual EAP is really structured for more of the routine, mild issues, mild complaints, minor medical issues. But there are also situations where you may have a relationship with an obstetrician or gynecologist, and you can do these things virtually because it may just be to follow up on whether the problem is being resolved, maybe some issue about the medication. So many of these things you don't really require to go in to an office. But to answer your question, yes, we have specialists and we continue to add to the list. The greater the virtual EAP is expanded, some companies in the estate, for example, who have been onboarded, they request occupational health physicians. We have brought those on for that particular clientele.
Okay, great. Thank you for that. We have a number of questions here that I would like to get to. One of the questions, I know you spoke to it previously, but if you could revisit that. How safe and confidential is your information, and how can you guard against hacking and accessing information?
Great question. So I did mention earlier that we signed something called the BAA, which is basically a business associate agreement. And when you sign that with Amazon Web Services, it means that everything that happens on our end, it's encrypted on the other side. So all you will see is the encryption if there's any hacking, right? Amazon Web Services is a pretty stable platform, very secure. They've invested a lot of money in protecting it. So because our ICT system is built to be able to be stored in the cloud using Amazon Web Services, and we have signed all of the agreements with HIPAA and GDPR, it's very, very secure. We haven't had any issues, and it's really when the patient or the employee utilizes the service on their end, they must secure their account, right? They must secure it, but it's timed out. So that's a good feature of it. They have to log back in, and when you sign up, so I've shared the link, but when you sign up, you will see that you have to verify using your phone. It's almost like what they do with Republic Bank, and you need a secondary password, a secondary verification. So it's very secure in that regard.
Okay, and second of all, who pays for this service? Is it the employer or the employee?
Excellent question. So that depends on the company. So we currently have companies. If it's something that is company related, the company pays for the service. So they would say they're sending, they're going to schedule an appointment for 1 or 2 sessions for, let's say, John Brown, and the company would pay for that. But if it's something private, something personal, then the employee pays for those services. But many times, on both occasions, both of them can use their health plans to pay for the services. And we accept all health plans. We have signed up with Guardian Life, we have signed up with Sagicor and Beacon and all of them. So so in addition to that, remember, the services are at a reduced cost. So the insurance companies actually love when they get a claim from us, because it's no longer $300 and $400 and $500. It's $200 and $300. So the claims ratio is decreased. Okay. I hope I answered the question about who pays.
Okay, great, thank you. And just to clarify, employers will also have access to employee patient files, or only the patients? And
only the patients.
Okay.
Patients always retain 100% of their patients' notes on the portal. Nobody has access to that. If it's the employer wants a medical report or a report from a psychologist or a dietitian or whatever they wish, and the employee has granted access to that, either the employee can forward, because you can download it as a PDF and provide it to the employer, or they can request that we send it to them. But the actual, when a patient's notes, when it's created, it's just the employee. It's never the employee. I'm looking at Carleen Hassanali. I'm now actually reading through the thing. So Carleen, and if not, will the employee get something from the doctor? Okay, so I hope I answered that. Or will employees know how many visits to pay for employers? if the employers have told the employees to book the appointments, we normally keep on our side which companies and how many persons have been seen, and we're hoping that, well, if they were sent by the employers, that they would also be keeping a tab on what's going on, or if the employee is fit for work, as an example, right? So yeah, I understand that. So yeah, so we can provide a fit to work as well, and again, this is done electronically. So I think I answered those questions, Carleen. And also, is the email address correct? Patient without the T. The email address.
It has PATIEN.
Oh, correct. Oh,
Patient.
yes. Yes. There's an error there. So yes, yeah. Good pickup, Carleen. So it's patient with a T. Sorry. I rushed down this last slide before presenting, but yeah, very good pickup. So it's a patient with a T, connect, and 2 T's at the end, and in connect.
Okay.
But I've also, let me, I'm seeing a lot of other questions. How do I, okay, so let me just put the link in the give me 1 second. And let me send you the link. So I'm going to put it up here, patientconnecttt.com/EAP. And you can then play around with it from there. You can look at the EAP. There's a PDF you can download. I believe it's the same PDF. You can download, and you could, if you have any further questions, you can reach out to us via that phone number, 685-HELP. That's our virtual assistant. Or you can send us an email at patientconnect@gmail.com.
And the next question, we are a Trinidad and Tobago registered business. If members of our team are in another country, can they avail themselves of this service?
Derek, yes, it's virtual, so they can definitely access it from anywhere. And that's another great feature for, so, if they want to speak, let's say, they're Trinidadians in another country, many times they want to speak to somebody from their own country, because of the language, the culture, we'll understand them. In fact, we do something with the diaspora currently. We have many members of the diaspora, people living in Miami, New York, even in the UK, they utilize Patient Connect. And they're happy to reach out to a doctor who is living in Trinidad and Tobago, simply because I guess we tend to understand the situation a lot better. So there's an advantage of that. So to answer the question, yes, Derek.
And next, can you speak to the quality control of the psychologists/counselors in your network? What are the minimum qualifications and experience?
Very, very good. So all of the providers in Patient Connect are registered with the various boards. So for example, all the doctors, all the specialists are registered with the medical board. The psychologists are all registered with the Trinidad and Tobago Association of Psychologists. And when we did during the pandemic, when we started as virtual wellness, we provided those free services. We're talking from the president of the association, the secretary, what we call the top brass. All of them had provided free services, and many of them have transferred over. So we accept members who are registered with the various organizations, including TTANDI, which is the Association of Nutritionists and Dietitians. So we don't accept any provider who is not registered with their board. And in terms of the years of experience, we tend to ask them, if they have just come out, maybe they can join in a year, 6 months from now. They need to build up some experience. So we definitely, you know, we do have registered people on the site.
And I know that you would have mentioned previously that you can access the cost information on the site, I believe, but are there any of the costs, any of the starting costs for the service that you can share with us?
Starting cost, meaning, okay, just 1 second. The SquanCap said that she have tried the website and the site can't be reached. Make sure that it's Patient Connect, and the connect is 2ts.com. So if you want to try it again, and you could probably tell me if you're getting through, because I think it's just maybe the T or so. Yes. It's, so the cost to sign up, there's no cost to sign up to use the virtual EAP. It's just what the employee requires, it's what they pay for. Or if the company's paying for it, it's what they pay for. So if it's, as I said, a GP visit, it's $200. If it's a dietitian visit, it may be $200, $250. Okay, so I see Colleen is getting on the site, right? So there's no retainer fees. You don't have to pay anything monthly as a company or as an individual. There's nothing to be paid. The onboarding is free, the signing up is free. It's just what you use. Okay, I see Ms. Juan Capello has got on there. So yeah, so it's basically you pay for what you use.
And you would have mentioned previously, persons or companies could sign up for the mailing list at no cost.
Correct. So let me just give you a little information about that. So we currently have companies, let's say on the estate or other companies we work with. What we send them a particular Excel spreadsheet, and let's say they have 100 employees. They would populate that spreadsheet. All we require is the first name, last name, an email address, a valid email address, and a phone number of the employee. And once we get that, we onboard, we put it into our system and they become onboarded. Once they're onboarded, then they get access to the emails. Obviously, if they're not on the system, they can't get access to the emails or the SMS or whatever we will be sending out. So the only way they can get access to the emails is when they become onboarded. Being onboarded has many benefits. When they require the service, they're already there. So they just have to log back in to utilize the service. Being onboarded, they get access to all the emails. Being onboarded, they get access to the blogs. Getting onboarded, you know, they're just part of a community, and you know they can as we update our list of providers and various services, they will get updates as well, so they can see what other services they have access to. So there are many benefits of being onboarded. You don't have to necessarily onboard them. You can just utilize the service as a one-off. But you know, if you're providing I think a virtual EAP to your employees, it's best when they're onboarded. There are many more benefits of it, and that is a free service. Any further questions? If you need to reach out to me directly, you can send me a WhatsApp. So let me just put my number in the chat. So my direct line on WhatsApp is 475-8123. And you can always send me a WhatsApp if they, you know, you can send an email, yes, and we can do that. Now, what we also do is that to kind of get the employees a little bit familiar with the service, if you wish to organize something with the employees, we can do a Zoom with the employees, either myself or the virtual assistant or a product specialist. We have various people who can do the Zoom, and we can schedule a free Zoom to really talk to the employees about it, so that they kind of begin to understand it. Because yes, telehealth, even though telehealth has been around for a while, in this country, you know, we're now getting used to it because of the pandemic. We're now beginning to understand more about digital healthcare, which is more than just telehealth. There are other services under digital health, like home care and these kind of things, virtual home care. So if you wish, as you know, you want to have a Zoom, we can do that with your employees. And also we do provide lifestyle talks, virtual lifestyle. It's part of a series. So if you want us to address the topic of diabetes, or you want to, we can address hypertension or something with the diet. We can definitely do these talks. These talks do have a fee to them, part of the series. But if we're talking about the platform itself, there's no cost associated with that.
Hi, will you be sharing the presentation with participants or sharing it with TTCSI to send out to participants?
Yes, so let me just make the corrections on this presentation I did here, and I will send it to you, Kavita, and you can share it with everyone. But if you wish, the presentation is also available if you go onto the Patient Connect site, which with the corrected one that we sent, the Patient Connect, and you go to the EAP and you scroll through the EAP page, you will see the PDF. It's there, so you can download it directly from there. It may have this error as well with the email, but you know, or I can also correct it and send it to you, Kavita, and you could share it.
Perfect. We will look out for that and send it out to all participants.
Yes, and the Zoom from today, you can also, you're going to be sharing it.
Yes, shortly after this session, we will prepare the link and send out to everyone.
Okay, good. So yeah, so that would be really good. So people who could not make it, if you have someone here right now who can share it with their other HR colleagues, you know, so at least they're kind of familiar with the program, it would be good, it would be appreciated.
Not a problem. So do we have any more questions for Dr. Murad Ali? Well, yes. That one is directly for you, Dr. Murad Ali. What is your specialization?
Oil and gas. So I'm an oil and gas physician. I do work with many companies, both on the estate, Atlantic LNG, Tucker, you know, Kenson, a lot of these companies. So it's my area is I focus on oil and gas, but I'm also the managing director of Patient Connect. And I do believe that, you know, telehealth is part of the whole hybrid system. It's not just visiting a doctor physically, but I think there's a lot of benefits with using, you know, virtual services. Thank you very much, Jenny. Thank you very much, Ms. Arno. for the comments. I see Monica said she got the presentation. So, thanks a lot for these things. It has not been very easy because setting up an ICT platform in Trinidad and Tobago during a pandemic was very, very difficult. There are many platforms outside of Trinidad and Tobago. Zoom has something for healthcare. You have other things in the US, but it was very, very difficult to find IT people, programmers locally to be able to build what we wanted. We had the vision. I had the vision with some others to build this platform. But we have done it, and we have been using it with both on a B2C, B2B basis. And we're really, I think, positioned to offer it now to a much wider cross section. Hence the reason, we have been approaching companies, especially the HR departments. I think it can certainly solve a lot of issues, a lot of challenges from an HR point of view. And I think it's a great thing to offer all of the people who work with you, whether even the contractors, a virtual EAP where they have access 24/7 to services. Even we have lawyers on board. So if somebody may have a quick legal issue, and it's not, these hefty prices that you have to pay, maybe $300 for to get a legal opinion on something, they can access that. So if they need information about insurance or so, we have persons on the platform who deal with that. Physiotherapy, nurses. We've had a lot of people who prefer sometimes to use the nurses on the platform simply because they may have it's on a personal basis. They may have a relative who is home, bedridden. They want some information about, wound care or a bed sore or something. They reach out to our nurses. Our nurses, I think it's about $150 or so they charge for their service. They get a good, decent consultation. Again, these are healthcare professionals. So, they give the best advice possible. And, a video call, just like how you're seeing me, that's how it's done. And it's very, very simple to use.
Dr. Mardali, I know, well, we spoke about the various specialties, etc., of the doctors on the platform and such. I know that we have representatives from the Trinidad and Tobago Association of Midwives here. And I was wondering, is there a role for midwives in EAP, and if so, how would that work?
Very, very good. So yes, absolutely, there is a role because Patient Connect, while part of Patient Connect contains the virtual EAP, we also have people from the public using it. So when people from the public come onto the platform, they will be able to see all the providers. And of course, if they wish to speak to a midwife, they can connect with them. We currently have no midwives, and therefore we can definitely have that discussion with the association, definitely. So, we can make that connection. And I would definitely, put it to the team that we will welcome the support and the services of the midwives.
Excellent. Thank you so much.
I saw someone had asked, how they can become a provider on the platform. So I'm guessing that they have a specific set of skills that I'm not too sure if it's a psychologist or if it's a midwife. I'm not too sure. But if they fall under any of the providers, yes, to become a provider, it's really, really simple. They just reach out to the 685 help number. They can send an email, they can contact me directly, And the onboarding is very simple. All we need is your name, your email, and a phone number. That's it. And you're onboarded. Once you have your portal, you can put up your picture, you put your qualifications, and you can do what is required to really in your profile page. So you will have a profile page, and this is what the public would see when they come on to the service. Okay, I'm seeing it's a midwife. Okay, so yeah, so we definitely kind of follow up there.
Perfect. If there are no more questions, I would like to take this opportunity to thank everyone for attending today's session, and especially to thank Dr. Muradali for such an engaging presentation and for answering all of our questions in a very detailed manner that could provide additional insight into EAP and how it can benefit our individual companies and employees. So you do have Dr. Muradali's contact information. You have virtual Patient Connect's contact information, and the TTCSI will be emailing all participants later today. And we welcome, if there are any follow-up questions or comments, please feel free to reach out to us. We are here to continue the engagement, and we look forward to hearing from you all. So once again, thank you everyone for joining us, and we do look forward to future engagement. Have a good day.
Okay, thank you very much. Thank you, everyone.